Hello, my dear friends. Welcome back to Biology Explained. The novel coronavirus SARS-CoV-2 causing COVID-19 disease has already infected almost 86,000 people. Number of deaths is almost 3,000 and number of people recovered is almost 40,000. New cases outside China seems to increase gradually. The new death found worldwide is shown in the table marked in red. Now let's jump into today's topic. Today's topic is, are pregnant women at higher risk with COVID-19? I am referring to the journal as shown here, which was published on 18th of February 2020 in American Journal of Obstetrics and Gynecology. COVID-19 is an ongoing disease and potential pandemic, and limited information is available with COVID-19 during pregnancy. However, SARS and MERS might give us some idea about COVID-19 effects on pregnancy since all of them are caused by coronavirus. Data from SARS and MERS are also limited. In case of SARS, the case fatality rate with pregnancies was found to be 25%. Mechanical ventilation was 3 times more in pregnant women compared to non-pregnant women. In case of MERS, 3 patients died among 13 cases reported. 2 pregnancies had fetal demise and 2 were born preterm. However, in both cases, that is in case of SARS and MERS, no in utero, that is vertical transmission from mother to fetus was not observed. Let me explain you in brief about what is meant by vertical and horizontal transmission. In case if transmission of a particle, in this case virus, occurs from one person to the other, then it is horizontal transmission. However, if it occurs from mother to the fetus inside the womb, then we can say it is vertical transmission. So, evidences suggest that neither SARS nor MERS had vertical transmission, and all of these viruses had very high horizontal transmission. According to the study by Chen et al., 9 pregnant women were diagnosed with COVID-19 in their 3rd trimester. Their clinical symptoms were found to be similar to non-pregnant adults in this study. 7 of them had fever, 4 of them had cough, 3 had muscle pain and sore throat, 2 had feeling of discomfortness, and 5 had lymphopenia, that is low level of lymphocyte in the blood. All of them had pneumonia. However, none of them required mechanical ventilation and none of them died. All the women had cesarean delivery. In another study by Zhu et al., 9 pregnant women were taken. 4 had symptoms onset on 1 to 6 days before delivery, 2 had symptoms onset on the day of delivery, and 3 had symptom onsets 1 to 3 days after the delivery. Among these 9 pregnancies, 7 were caesarean deliveries and 6 infants were preterm. However, in all the cases, clinical symptoms were similar to non-pregnant patient. So, till now, it seems good that the severity of the pregnant women are same as the non-pregnant women, although pregnant women are in general immunocompromised. But since the number of cases are very limited, it would not be wise to conclude anything from here. We should wait to get some more evidences. As in case of SARS and MERS, mother to fetal transmission has not been identified with COVID-19. However, there was a report in media that a 30-hour infant was diagnosed with COVID-19, suggesting vertical transfer. But due to insufficient information, this possibility is ruled out. In first study by Chen et al., amniotic fluid cord blood, neonatal throat swab were all negative. In the second study by Zhu et al., some infants showed shortness of breath, gastric bleeding, but the throat swabs were negative, suggesting that symptoms were not due to COVID-19 disease, that is, not due to SARS-CoV-2 virus. Breast milk tested for SARS-CoV-2, that is COVID-19 virus, was negative. Thus, until additional data is available, mothers are encouraged to feed infants with their breast milk. It should be given after she is no longer considered infectious. Thus, to conclude, although the studies were done with small number of samples, COVID-19 seems not to have more adverse or severe effect on pregnant women, and no evidences of vertical transmission from mother to fetus is observed, and the breast milk seems to be negative for viral RNA. So that's it guys for today. If you think these informations are useful, please hit the like button and subscribe and support my channel. Thank you.